Hello everyone, myself Preeti Sharma from AKtU Gazeba. Today I am going to deliver you a lecture on the topic, that is a journal prevention of cholera and the control of cholera. How we will main focus we will give on the prevention and the control of cholera. So, cholera is an acute secretory diarrhea caused by the gram-negative bacteria, basically the Febrile cholera, and cholera epidemic have been recently increasing in intensity, duration and frequency, highlighting the need for more effective approaches to prevent and the control of cholera. Means cholera is an diarrheal disease, we can say, and it is basically caused by the Febrile cholera. And now Febrile cholera is basically a member of Fibroneaceae family, and the gram negative roots that are found in coastal waters, and this organism grow best in the presence of salt, although the Febrile cholera can grow in water or lower salinity. Means this bacteria Febrile cholera is basically grow in the salinity region, or the lower salinity, grow in water when it is warmer and contains sufficient organic nutrient. Febrile cholera is often associated with the zooplankton and shellfish in water, and it is capable of utilizing the chitin as a carbon and nitrogen source. Cholera is basically transferred through the fecal disease spread when the fecal of infected person comes into the contact with the food and the water. And this chitin induced natural competency in the Febrile cholera, suggesting that lateral gene transfer may occur in water, particularly during the zooplankton blooms. In water, Febrile cholera enter a viable but not culturable from also called the active but non-culturable or conditions viable environmental cells. Now, I will discuss here the pathogenesis and the pathophysiology. Means what are the pathophysiology, or what are the physiology behind this Febrile cholera. Febrile cholera accumulates first after ingestion of Febrile cholera. This basically accumulate in our stomach, and then after entering into the stomach, it will produce the toxins, and this toxins will bind to the G protein coupled receptors. After binding with the G protein coupled receptor, it inactivate the GTPase enzyme, and it will increase the CAMP. After increasing the CAMP, there will be an activation of ion channel. It will activate the ion channel by increasing the CAMP, and after increasing the CAMP, there will be an activation of ion channel, due to which there will be an influx of sodium ions into the intestinal lumen, and there will be a drag out of lumen. There will be a drag out of water from the lumen, and it ultimately leads to the water diarrhea. So, here Febrile cholera, after ingestion of Febrile cholera, the majority are killed by the gastric acid surviving organism colonizing this small intestine and elaborate cholera toxin. The major virulency factor for pathogenic strain of Febrile cholera. Cholera toxins is a protein exotoxin that consists of a single A subunit associated with the 5 B subunits. As I told you, after the production of toxin, it will bind to a G protein coupled receptors, and it ultimately inactivate the GTPase enzyme and increase the CAMP pathway, due to which there will be a activation of ion channel. Here you can see the CAMP pathway. Here you can see the CAMP pathway, means if toxins is produced, we can say here see virulency. If this second major virulency factor of pathogenic strain Febrile cholera, they will release Febrile cholera, if they will release the toxin substance after the accumulation in the stomach, then they will colonize in this stomach, means they will produce the toxin substance and they will bind to the G protein coupled receptors and inactivate the GTPs, due to which there will be an increase in CAMP. If there will be an increase in the CAMP, then we can say there will be a influx of ion channels, means sodium ions will come, or we can say the chloride ions, NaCl, or we can say sodium and chloride ion will influx into the intestinal lumen and they will drag out the water from the lumen. Ultimately it may cause the secretory diarrhea. Now, the mode of transmission by the direct contact, contaminated food and drinks, and the fecal contaminated water, or we can say the infected person, through the infected person come in contact with the food and the drinks. Now, here we will discuss the major how we can diagnose the cholera. Before discussing the diagnosis, I want to say that the complications of diarrhea may leads to the severe dehydration if there will be a loss of water, or we can say the secretory diarrhea, there will be a loss in water, or we can say the body fluids will lose out. Then there will be severe complications, means severe dehydration will occur to the patients, and ultimately in the complication after the severe dehydration there will be a shock and it will leads to the renal failure, and ultimately the patient comes under the death. Means it is in the severe case, or in the major complications are this severe dehydration that ultimately leads to the shock, renal failure and the death. Now, these are some diagnoses, how we can diagnose the febrile cholera. According to the WHO, a case of cholera should be suspected when a patient aged 5 years or more. Here I given some cases which I have quoted from some of the review papers. A patient aged 5 years or more develops severe dehydration or dies from the acute watery diarrhea, even in an area where cholera is not known to be present, or a patient aged 2 years or more develops acute watery diarrhea in an area known to be have cholera, where microbiology facilitates febrile cholera infection can be confirmed by isolation of an organisms from the stools on selective media, followed by the biochemical test as well as the serogrouping and the serotyping with the specific antibodies. Means if you can see here, this watery diarrhea, if we will culture this febrile cholera, this can be confirmed by the isolation of organism from the stools. If we isolate this cholera, fibroic cholera, the causative organisms, if we culture it with the help of serogrouping and serotyping with specific antibodies, then this serogrouping and serotyping with the specific antibodies, there will be an enrichment of stools in alkaline peptone water and can leads to increase in sensitivity of culture. Cholera can be rapidly diagnosed by examining the fresh human stool under 400 that is dark field microscopy. After culturing it, we can see the dark field microscopy for fibroid shaped cells. We can see here the shape of this fibroid shaped cells can be seen. After the culturing, we are seeing under the microscope, dark field microscopy, then we will see here the fibroid shaped cells with darting motility, that is we can see with the specific antibody, and half of the culture positive stools are, if the culture positive stools are positive on the dark field microscopy. Now, these are the prevention and the control of our disease, how we can prevent and control the cholera. First one is rehydration, second one is maintenance phase. How we can, rehydration means, and what is maintenance phase? This both terms differ. Rehydration means in the as I told you that in the cholera there will be dehydration, means there will be loss of body fluids, loss of water from the body, that is called dehydration. If rehydrate, if we are means rehydration by giving an ORS involves this rehydration basically have a three simultaneous process, it undergo the three process. First one is imbibition of water, imbibition of water. Second is swelling of the dry material. Swelling of dry material, and third is leaching of soluble material. Means these are some three processes in the rehydration. First is imbibition of water, second one is swelling of the dry material, and third one is leaching of soluble material. Now, the next one is maintenance phase. Maintenance phase, normally hydration status, we are replacing the lost water, ongoing losses we are replacing with the maintaining the normal hydration. If we are maintaining the normal hydration by replacing the ongoing process, that is called maintenance phase. And rehydration, by giving the ORS, we are rehydrating, means with the help of oral rehydration or by giving the oral rehydration salts, we are rehydrating, means we have to overcome the dehydration, then we have to use this two treatment. First is rehydration and second is maintenance phase. As I told you that rehydration phase is imbibition. First is imbibition of water, and there will be a in the second step there will be a swelling of dry material, and third one is leaching of soluble materials. These are some WHO guidelines. WHO works to promote the design and implementation of global strategy to control and to develop for cholera prevention and control globally. If we have to prevent, WHO have given some guidelines how we can promote and how we can prevent and control the cholera. Now, the next one is provide a forum for technical exchange, coordination and cooperation on cholera related activities to strengthen the country capacity to prevent and control the cholera. And next is support the countries for the implementation of effective cholera, controlling the strategies and monitoring of progress. Now, the last one is disseminate technical guidelines and the operational manuals. Another is WHO guideline. It basically support the development of research agenda, which basically emphasize on evaluating the innovative approaches to cholera prevention and controlling in affected countries, increasing the visibility of cholera as an important global public health problems through the disseminations of information about cholera prevention and the control, and conducting advocacy and resource immobilization, that is various activities to support and prevent the cholera. And we can at the regional and the global level we can control this cholera with the help of this WHO guidelines. As I told you that rehydration phase, as I told you, basically we are using as a treatment ORS, we are giving ORS for the to overcome the dehydration. Rehydration is the cornerstone of management of patient with cholera. Early attempts at oral rehydration met with the limited success because the physiological requirements for sodium glucose co-support were not recognized, and the introduction of oral rehydration solution in the late 1960 utilizing the equimolar concentration of sodium and glucose to maximize the sodium uptake in the small intestine, and carefully we are replacing the preceding and the ongoing fluid losses in the current cholera treatment. Now, the next is the maintenance phase. As I told you, the normal, we are maintaining the normal hydration status by replacing the ongoing losses, and the basic goal of maintenance phase is to maintain the normal hydration status by replacing it with the losses of the body fluids, and the oral route is preferred. The use of ORS at a rate of 500 to 1000 ml per hour, and fluid should never be restricted. These are some another treatment method, or we can say another treatment we can say with the help of antibiotic therapy, antimicrobial therapy. We are giving the antimicrobial treatment to the patient in the case of cholera. One of the, that is prevention and controlling the cholera with the help of antimicrobial drugs like trimethoprim, ciprofloxacin, ofloxacin, doxycycline. These are some antimicrobial treatments, therapy we can say to control the cholera, and tetracycline has been shown to be an effective treatment for cholera, and it is superior to furolazodine, chloramphenicol, sulfaguanide in reducing cholera morbidity. Treatment with a single 300 mg dose of doxycycline has been shown to be an equivalent to that of tetracycline treatment. Means as I told you, that is antimicrobial therapy, tetracycline, ofloxacin, disocycline and doxycycline and ciprofloxacin. These are some antimicrobial therapies, antimicrobial drugs which is giving during the as a first line treatment to the adults. Basically the doxycycline has been shown to be an equivalent to that of tetracycline treatment and it is now recommended as first line treatment in adults, including the pregnant women and in children's. These are the children's less than 12 years of old. We are giving the first line drug choice, means first line drug of choice is doxycycline 2 to 4 mg per kg by mouth in a single dose, and alternative drug of choice is azithromycin 20 mg per kg single dose, and ciprofloxacin 20 mg per kg we are giving in a single dose. Next is children if more than 12 years, then we are giving the doxycycline, that is 300 mg single dose, and in the alternative drug of choice we are giving a azithromycin 1 gram in a single dose. These are some prevention and control, means drink and use the safe water. Safe water is water that is bottled with the unbroken seal, has been boiled or has been treated with a chlorine product. Wash the hands often with the soap and the safe water. If no soap is available, scrub the hands with the ash or we can say with the sand and rinse with the safe water, and do not defecate in any body of water. Cook food well, do not eat the bush food and eat it eat it hot, keep it covered, means all the food material should be covered, and peels the fruit and vegetable, means clean or sanitation condition should be maintained, then we can prevent the cholera. And they clean up safely in the kitchen, and it must be places where your family baths and wash the clothes. Now the next is do not overemphasize antibiotic treatment of cholera at the expense of the recommended primary treatment of oral and intravenous rehydration. Doxycycline cost approximately, you can see here in the courses of doxycycline and azithromycin. Antibiotic can cause the nausea and the vomiting. Gastrointestinal side effects should be carefully monitored, especially in the dehydrated patients, and in general antibiotics should not be given to the cholera patients with only some or the we can say no diarrhea or to the dehydration. These are some 5 basic steps to prevent the cholera. Drink and use the safe water. Wash your hands often with the soap and the safe water, and use the proper we can say use the cooked food well, keep it covered and eat it hot, and peel the fruit and vegetable as I told you in the previous slides, and clean up safely in the kitchen and in places where the family baths and wash the clothes. This is some we can say how to avoid the cholera by washing the hands, and before and after the meals, how to stop the cholera. Prepare the safe food, wash your hand, keep the toilet cleans and treatment of cholera with some of the rehydration treatment by the antibiotic therapy. For example, ciprofloxacin, ofloxacin, trimethoprim and doxycycline, these are some antimicrobial therapies. And now it is a last but not the least, these are some references. You can see these some review papers and research papers, how we can prevent. I have quoted from the review and research papers the some of the references. Thank you for your patience.